This is our chance to march forward. I can't promise you that the reforms we seek will be perfect or make a difference overnight. But I can promise you this. We will look back many years from now and say, this was the moment we summoned what's best in each of us to make life better for all of us. This was the moment when we built a healthcare system worthy of the nation and the people we love. This was the moment we earned our place alongside the greatest generations. And that is what our generation of Americans is called to do right now.
At the Department of Health and Human Services Centers for Medicare and Medicaid Services, our mission is service. CMS is an important agency with a huge job. As the nation's largest health insurer, our programs protect 90 million seniors, children, and people living with disabilities. The rules we make affect the way medicine is practiced and safeguard everyone who uses hospitals, nursing homes, and labs. To do our job, we depend on the talent, energy, and commitment of the people who work at CMS. Meeting the challenge of transforming the future of healthcare in America needs all kinds of people. Doctors, lawyers, economists, computer scientists, public health service officers, even TV producers. If you want to learn more about challenging and rewarding careers at CMS, meet just a few of the dedicated people I work with.
The true test of government, the true test of a society, the true test of a civilization is how it treats its most vulnerable. So this agency is dedicated to reaching those populations, and I feel really privileged to be able to work here, to come every day, to work with a really dynamic, motivated, smart, talented group of people to ensure that the most vulnerable people in our country have a chance, have access to health care.
We do what we do for seniors, kids, and those with disabilities. CMS is a wonderful place for physicians to work because it is the largest insurer of health care in the world. Clinicians, including myself, were oftentimes frustrated at some of the policies that emanated outside of CMS, and it had always been my belief that one should take an active role in trying to improve the clinical landscape in which clinicians and physicians provide care to Medicare and Medicaid beneficiaries in the country.
Having child care services here is really important to me because when I come to work, I feel comfortable that my child is being cared for while I'm still doing intensive work, and at a moment's notice I can go downstairs and tend to him if I need to, or continue working if I have to. So it's really an essential part of my ability to be able to work and to feel comfortable working.
People in my division that have background in mental health, there are folks that have a background working with the aging population and with developmental disability, and now myself working with folks with physical disabilities. And it's a really kind of a broad spectrum that comes together, and we're all very passionate about our work. I received a very warm welcome from my colleagues, and we really, I think, all kind of consider ourselves an extended family and work very well together.
All of us know at least one Medicare beneficiary, whether it's our parent, an aunt, a grandparent, and there's nothing like being able to feel like the work that you're doing will have an impact on their health and their health care delivery. We test different ways to pay or deliver services to help Medicare beneficiaries manage their chronic conditions and basically improve the delivery of care, and that is really fulfilling and rewarding as a researcher to be able to do that work every day here at CMS.
Having worked in human resources for over just about 20 years, I was looking for something that was more meaningful. And I had the opportunity to work in some premier organizations, and I wanted to do something beyond just working in an organization. I really wanted to give back. And working in an organization like CMS, working for the federal sector, particularly at this time in our history, is very important. And I wanted to be a part of that and to have an opportunity to really serve our country and doing the work that I do every day, which is human resources. And so what better way to sort of marry, you know, what I enjoy doing, which is HR, but also working in the federal sector where you give back every day.
At some point within the first year, I was having so much fun here that I had to pinch myself to realize this wasn't a dream. It was really just enjoyable to wake up every day and come into the office and work alongside colleagues who had actually become friends of mine. And so it's been a really wonderful place to work. Also, we have a post office, we have a wonderful cafeteria, and we have free parking and a lot of different types of family-type services. I see myself here for a very long time.
Nearly 50 years ago, in the midst of the noisy early battles to create what would become Medicare, President Kennedy said, "I refuse to see us live on the accomplishments of another generation. I refuse to see this country and all of us shrink from these struggles which are our responsibility in our time. Now it falls to us to meet the challenges of our time. And if we can come together and listen to one another, I believe, as I always have, that we will rise to this moment, we will build something better for our children, and we will secure America's future in this new century."